Hello all, my name is TaheedaForrest and I'm doing my signature assignment on Alzheimer's disease, which is also a stage of dementia. This is for Psi 1040, Human Physiology, Dr. Muhammad Khalifa. And this is at Standbridge University, and today's date is March 30th, 2025. So Alzheimer's disease is a brain disorder. Alzheimer's disease is very progressive. It's a neurodegenerative disorder. And that's going to be characterized by the deterioration of an individual's cognitive functions, including memory, reasoning, as well as language. It primarily affects older adults. So individuals who are 65 or older are at more of a risk of Alzheimer's disease. It is very common, as well as dementia. Although it is not a normal part of aging. A lot of individuals will think that Alzheimer's disease, dementia, these things are normal parts of aging. It is not. The disease is associated with the accumulation of amyloid plaques and impaired synaptic functions. Who has Alzheimer's disease? Well, Alzheimer's disease can affect individuals across various demographics. Most commonly, as stated before, it is in older adults, but scientists have discovered Alzheimer's disease actually can affect all ages. Genetics, some people are more prone to getting these types of diseases based on genetics. Sometimes it can also be based on lifestyle, family history. Sometimes it can also be based on the environment. A lot of times you can be in an environment that can be very toxic to one's health. It can cause cognitive disorders that can lead to Alzheimer's disease as well as dementia. The youngest person that I've met was 34 years old who had Alzheimer's disease, and it developed through post PSD or PTSD from him being in the military and having traumatic experiences serving in the military. He would sometimes have different tactics to try and forget things that were not pleasant. And in those habits of forgetting things, he slowly but surely started to lose his memory. And at the young age of 34, he was diagnosed with Alzheimer's. Here you could see a healthy brain versus a brain with Alzheimer's. You can definitely see the effects that it has on the brain. Certain genes also have an effect on the brain. APOE are associated with an increased risk of developing Alzheimer's. Advancing in age like I said, is a very significant way of getting Alzheimer's. Factors: sometimes when you're exposed to toxins, this brain here is a brain, if you look over to the right bottom, that brain has been exposed to toxins and pollutions, and other environmental agents may have contributed to the disease. Onset neuropathological changes, as well as the accumulation of amyloid beta plaques and tau tangles. And these are scientific facts of things that can affect the brain, to make your brain a little bit more prone to these types of diseases, such as Alzheimer's. In this slide, we are able to just kind of see what the brain looks like as we kind of look at it with the violet lights. So some of the diagnoses, unfortunately, scientists and doctors and medical health providers don't really have a real diagnosis as to where Alzheimer's comes from. To be 100% honest with you, the only way that you're clearly diagnosed with Alzheimer's is after death, when they're able to cut the brain open and just kind of diagnose the brain and the cells and to see what was damaged at that time. It's unfortunate that we don't have a way of really diagnosing it, but we still do try. Diagnoses, they do involve a very comprehensive evaluation that includes a detailed medical history, a cognitive assessment, neuro examination. Clinicians, they do typically use standardized cognitive tests to assess memory problems, how you're solving them, such as your language skills. Sometimes they'll use an MRI. This is a PET scan that we're seeing here. That way you can kind of get an idea of an early diagnosis. The earlier you can get a diagnosis, the better. If you kind of see those early signs, it is crucial, for effective management. But there is no cure. There is no cure for Alzheimer's or dementia. Some of the symptoms that you'll experience with having Alzheimer's would be forgetfulness, memory loss. These are some of the main things that individuals go through. I work in a long-term care facility, and it's an assisted living, and I would say 90% of the residents here are senior citizens that have Alzheimer's, who are not able to function and need help with their ADLs, which is assistance with their daily life. Things such as brushing your teeth, you'll forget how to do it. Things such as speaking. I've even heard individuals say they would forget to breathe. We actually had a case where someone passed away because she forgot to breathe. And that was very unfortunate. You definitely will have forgetfulness of familiar faces, names. Sometimes you'll repeat questions or stories, or even tell those stories again. So it's very unfortunate, and doctors, nurses, medical health providers are still working towards a cure for this terrible disease. Some of the treatments, unfortunately, is not curable, but cognitive rehabilitation, occupational therapy, lifestyle modifications. Those are some of the things you might want to think about that would benefit your lifestyle, as well as catch early signs or even preventing things such as dementia or Alzheimer's. I did want to leave a couple resources here. These are some organizations as well as some helplines that are very useful. They're all within the area. You don't have to necessarily be diagnosed to be forgetful, to have cognitive or memory loss, or experience things that could be very similar. So I did want to leave a couple different resources for anyone interested in taking these down. I do think that they'll be very helpful. I wanted to leave some of my references. And that will wrap it up for my presentation, my signature assignment on Alzheimer's.